Welcome back to the FutureBets web series. This is our final webinar in this series. We have two phenomenal women on our panel today, and they are coming to you live from Bangalore and Boston. As you may know, we were very bummed to cancel our event this year, but are very excited to host the online version. And we had some of the brightest minds from all around the world come speak to us. To watch the previous webinars, check out www.makefuturebets.com. But before we start, protocol dictates I introduce our group, our speakers, and myself to you. Very quickly then, Ashika Group is a 25-year-old diversified financial services group offering services such as brokerage, lending, investment banking, wealth management, and asset management. Our team of 300 plus work together to provide services to over 125,000 retail clients, 100 plus institutional clients, and 100 plus family offices. And I, Ishita Jain, will be your moderator for the evening. I'm part of the Institutional Equities team at Ashika Stock Broking, where we write proprietary research for unique stock ideas and service some of the top public market funds of the country. I hold a master's in biotechnology, enterprise, and entrepreneurship from Johns Hopkins and a biochemistry degree. Before Ashika, I had a brief stint at a healthcare-focused investment bank on Wall Street. Let's begin today's webinar on Virology Meets World. Our panel is diamond encrusted today with Kiran Mazumdar-Shaw and Pardis Sabeti. Kiran Majumdar-Shaw is a biotech veteran, a bellwether in the business. She spearheads Biocon, India's first and the largest biotech company. She's the recipient of Padma Shri and Padma Bhushan. Our second panelist for today, we're waiting for her to join, is Pardis Sabeti. She's a professor of immunology and infectious diseases at the prestigious Harvard School of Public Health, an institute member of the Broad Institute of Harvard and MIT, and a Harvard Hughes investigator. She was named the Time Magazine Person of the Year as one of the Ebola fighters. Good evening, Kiran. Thank you so much for giving us your time.
Welcome. It's a pleasure.
Thank you. The format of the webinar is going to be a panel discussion moderated by me. So I think we should start. Maybe I can ask Kiran questions dedicated to you, and then once Pardis joins, we can talk about what she does as well. So, Kiran, we are living in the times of the coronavirus pandemic. During this battle against the virus in the past few months, can you briefly talk about what your experience has been? Just overall, we can get into the details later.
Well, let me speak from India's point of view. Obviously, we all, across the world started hearing about the coronavirus, outbreak since January. But I think everything sort of came to its head only in March. And at least the one good thing that India did was to order a lockdown in mid-March. And I think that actually has helped us to contain this pandemic to a certain extent. And for a country of the size of India, I think it was extremely vital to lock it down. I also believe that this pandemic has shown us that it is scientific counsel and medical counsel that should prevail, because I think politicians have failed to take the right decisions, as we can see in many, many parts of the world. I think the US is a great example. I think the UK did the same, and many other countries around the world. I think politicians did not understand the gravity of the pandemic. They didn't even understand the scientific aspects of the pandemic and the viral aspects of the pandemic, and they just thought they could handle this like any other crisis. But I think that has been a very, very big, rude wake-up call for politicians across the world. And I think the good thing in India was that our government did listen to scientific counsel, to health and medical counsel, and that's what led to that lockdown. Now we've just successfully completed 2 weeks of the lockdown. And of course, we do realize that whilst our numbers seem contained, we also know that we're under testing. Because right now we're only testing at the level of about 14,000 tests a day. That's how much we've come up. Initially, it was just a few thousand tests a day, and now it's ramped up to about 14,000. But we need to test at the rate of at least 100,000 tests minimum per day, if not 200,000 tests per day. And I think until we get to that level, I don't think we will be able to extrapolate any data accurately. So right now we have about a little over 6,500 positive cases and about 250 or close to 300 cumulative deaths so far. And, there are about 10% of the people have started recovering and have been discharged. But that really doesn't tell us whether that's the real right number, because we know that the number of positive cases should be at least 4 or 5 times what is reported, because we haven't tested enough. We've got a lot of people under quarantine, but they haven't been tested. So I think we really need to make sure that we test more, we get a larger denominator, and then decide whether we are in a zone of comfort to start lifting the lockdown. So I think, there is every chance that the current lockdown might be extended by 2 weeks, because we really need to be in a state of preparedness. There are lots of very good approaches to what we are doing with the spread, or to contain the spread. For instance, there is a heat mapping in terms of threat levels being done in many, many parts of the country. So we are zoning the country into red level threats, amber level threats, and green level threats. And I think the red level threats, which we call the hot spots, are being contained and concealed. And I think the green level, sort of zones are also now being zoned off without any ingress allowed into those zones, so that they can operate freely. And the amber level zones are where they will do some partial lifting of the lockdown, but watch it and then see whether they need to release it further or bring back some controls. I think one of the things that most state governments have done is to make sure that people who are going to be in public spaces, of course, everyone is following social distancing. I mean, it's crazy to see a country like India without any traffic on the roads, and everyone following the social distancing at this point in time. But when you start lifting the curfew, it's going to be very difficult to actually practice social distancing in a big way. It's also very unfortunate that we have a large migrant labor force, and we have a large number of daily wage workers who actually come from villages. So obviously that was something that was not anticipated. I guess it was not planned properly. And many of these started, going back to their villages in droves. So there was an exodus of people moving in large numbers. And that was quite a huge challenge for the country. Of course, we do need to get into those communities to see whether there's been an infection which has been spread, because once that happens, it's huge. But having said that, we are at this point in time taking a lot of measures across the cities and hoping that, the spread has been contained to urban areas and it hasn't quite reached the villages. So that's the sort of broad dimension of what's happening in terms of the spread. Of course, one of the things as a biotech community, what we are addressing is, obviously we need to test these quarantined populations and clusters and what have you. And we realize that because there's such a huge demand of testing kits around the world, we realize that we also have to be self-sufficient in testing kits. The good thing about India is that we do have competencies and we are a manufacturing economy. So I think what we've done over the last few weeks is quickly come up with kits, indigenous kits, and we've actually in a position to actually cater to these 100,000 or even 200,000 kits tests per day with indigenously developed kits. That is one big thing that has happened. Then, of course, we started looking at other aspects of preparedness. So I think we started learning from other countries that one of the big demands was for ventilators. And we realized that as a whole country, we hardly had 40,000 ventilators. And we said, this is highly underprepared. So we started looking at companies that were making ventilators. And then fortunately, we chanced upon 2 or 3 of these companies that make ventilators. And they were actually making small numbers, even though they had the capacity to make much more. So very quickly, we've ramped up these capacities amongst these few companies in partnership with larger companies. And hopefully in about a month's time, we will probably have 30 to 40,000 ventilators being manufactured per month. In the meantime, we've also looked at a lot of the shortages around the world. So PPEs are in huge short supply, as you know, in the US. And we started repurposing many of our garment industries to make PPEs. We've also repurposed a large number of other garment companies to make masks, to make food covers, to make caps and other protective equipment. So I think the numbers are now going up, and I think in the next 2 weeks we will be in a much better state of preparedness when it comes to medical supplies, when it comes to kits. We're also all trying to develop these antibody tests. That will take at least 2 or 3 weeks. In the meantime, the country has imported a large number of antibody rapid tests, serological tests. So I think there's a lot of effort going on. And I think for the first time, the country recognizes and respects the biotech sector, which was always ignored and neglected, and only a few of us were doing what we could. But many of the smart, small companies were ignored, finding it so difficult to get capital. And now the government realizes that this is our, the golden nuggets that we have in our, biosciences and biotech sector. And now everyone wants to help this sector to grow, to be invested in, and to get connected, because a lot of these small companies are not able to scale up. So we're saying, okay, if you have innovation, we'll connect you to the larger companies who can help you scale up. So I think a lot of good things have come out of this. And I also believe that a very good thing that has come out finally is that science is being noticed, science is being listened to. And I think epidemiologists and virologists finally have found their space to be, to be effective and to be listened to. So I'll just stop there.
Thank you, Kiran. I think you touched up on some really interesting points. I did move back from America, and what I saw in the US biotech was leaps and bounds ahead of where we are in India, even in Israel. And I think the main difference was government intervention and government support. Thank you. We'll come back to you. Hi, Pardis. Welcome to FutureBets webinar.
You're on mute, Pardis.
Yes. Thank you. Nice to be here.
Great. So, Pardis, we've gone through the introduction. I will not bother you again with that. So let's just quickly, my question for you is, you were in the front lines of the Ebola outbreak in Sierra Leone, tracking the virus. You worked round the clock, and so did your lab in Boston. So if I may say, you have past experience seeing outbreaks up close and personal, which is rare. How has it been for this 2020 pandemic? How do we win against the virus? And can you also mention what your lab is currently working on?
Sure, yeah. So thank you very much. And just a real pleasure to be here. Yeah, so this is actually my fourth sort of outbreak to be involved in, like kind of heavy outbreak. It was Ebola, then the Zika epidemic, as well as the Lassa outbreak that happened in Nigeria, and now here. And we see time and time again very similar phenomena happening, where the world takes some time to understand what's going on. Detection is slow, and there's there's this kind of chaos that happens at the beginning, where a lot of confusion, and it can continue. But in this case, the few things that are a little bit different is that we had, well, there are some things that are different for the worse and some things for the better. I mean, this particular kind of virus is one that spreads much more quickly. And so that was, that is the major challenge that we've had, that this virus could get to so many different countries so quickly. And then as soon as it seeds, really, they go out of the barn very, very quickly and be everywhere. So that's the major challenge, the major difference when you're dealing with a respiratory infection of this nature that has, coronaviruses make up a large number of infections we have every year. This is just one that has more devastating impacts, and that is, one of the issues. But we know that coronaviruses spread quickly. That's one of the things, one of their features. You know, on the good side, what we did have is very quick detection by the Chinese to identify the virus, to sequence the virus within, you know, within weeks of it likely being seeded. We could see that there was already the genomes published, and the way we know the way we know we probably caught it very, very early is that all of the genome sequenced early on were almost identical. It tells you that we caught it just, that's a way that we can use to trace back how long a virus has been in the population. And it likely dates back to December and January. So we've only been in this for a few months, and we've already mounted such a major effort across the world. So that's very promising. But as Kiran said very, you know, articulately, this is the problem that we do have, is that for the longest time, it has been very difficult to fundraise and to get support for this. Many people, I always point back to Laurie Garrett, who wrote The Coming Plague decades ago, who's been talking about this forever, and how the frustration that so many of us have, where we've had such difficulty raising any support or funding to do this kind of work. You know, with it not being really, it seemed pretty low priority in a lot of global efforts. And it's shocking. To me, it's always been shocking, because I mean, it's not only, it's one of the, in history, one of the things that have killed the most people, the one that's devastated the most populations. If we're students of history, we should have known that this is where our priority should have been. And we're actually fortunate that this pandemic is catching our attention finally, but doesn't have the impacts of what it could have. Much higher fatality rates amongst our children and young people. You know, there are things that could be far worse and can still get far worse. Here, the fatality rate could increase. We don't expect it to, but we never know what a virus is going to do. It could change, and it frustrates me when I see young people who are like, oh, it's not my problem. I'm like, it can be. One, if you should be thinking about your elders, but if you're not, you should think about the fact that this is a volatile situation and could always change. And so we do very much hope that the world wakes up fundamentally, and you know, that this is a truly transformative moment, not just a moment that we then forget about all, you know, rapidly after it ceases. So we, you know, want the global community to move, to respond to this well, and then to find ways of path forward. And I think that it is true that there's a lot of technologies that are now finally, all these small different groups developing technologies that are finally getting attention and have that moment when hopefully people will support them to scale up in the way that they can do. As far as what my own lab is doing, we a number of things. So my lab is very interdisciplinary. I was a computational geneticist by my own training, but realized, but also have an MD, and have worked in the field mainly in West Africa for a number of years. That's how we came to be involved in the Ebola outbreak. And since then, we've really been developing a lot of technologies, both computational and experimental, to help respond to outbreaks. Things that we're doing, we've developed CRISPR-based diagnostic tests. This is sort of the new CRISPR that's transforming a lot of medicine on a larger scale because of its gene editing potential. CRISPR, just for a brief background, was first detected as bacteria's immune system to viruses. It's how bacteria detect and destroy viruses. And so both of those capabilities, the detection and the destruction, can be used both for diagnostics as well as therapies. And we're working along both of those lines. And we've developed with many others point of care diagnostic tests that could be based on CRISPR, as well as massively multiplex thousands of assays simultaneously. And so it's just a powerful, different approach, one of many. And I'm a very agnostic to my tech or anyone's tech. We want all tech. But we have, you know, a set of tests that we've been developing, already released our COVID tests, as well as these machine learning algorithms that we've developed in my lab to allow you to mine new genomic data that's coming in every day and develop the best guides given the new information. We've also, for years, have been developing mobile tech as well, and which is now a very popular thing, both you know, to support public health efforts in Africa, as well as you know, local detection as well. And so we have mobile applications that can capture diagnostic data, can help you trace contacts. one thing we've done for a very long time is actually we developed not a video game, an educational game that allows middle schoolers, we started with middle schoolers, but now has been used by adults and children alike, to basically model an outbreak on you spreading by Bluetooth on your phone. And so this has been a really great educational tool that we've used in a lot of schools in the United States to teach them about what a pandemic looks like, how to stop it. We've created these epidemiological models that allow you to model an outbreak spreading in a small population and allow you to experience that. And so our students who've done this game already know how chaotic it can be, how difficult it can be, how much we need to track these things. But we've used some of those Bluetooth models to also be able to look at that contact tracing that a lot of other people have as well, to model your community. So a whole range of things, but developing, we just mainly develop tech at every point along the tree, and work very, very closely with our African partners, like my partner Christian Happy, who sequenced the first genome out of Africa and is part of a group of individuals who is closely monitoring the outbreak as it spreads in Africa. So yeah, this is what we do. So a lot of different things in this space.
Very interesting, Pardis. It is sad to see that our industry is getting the attention that it deserves, and a pandemic had to be created for that. But anyway, my next question is for Kiran. Kiran, we hosted Dr. Jin from Beijing at the start of this web series, and she gave some insight into the life in China post-COVID. It was a ray of hope to see that life after Corona does exist. So in this post-COVID-19 world, whenever we reach it, with consumer behavior changing, global trade policies changing, what are some industry trends that you will foresee?
So, before I comment on that, Ishita, I just wanted to add to what Pardis said. I think, let's be very honest. People are not going to feel safe until the vaccine comes out. You saw that movie Contagion, and everyone was waiting for that vaccine to come out before anyone felt safe. And it's true today. It's almost like the movie coming true. And so I think we all know that the vaccine is going to take a year before it comes out. So I think till then, we do need to find effective ways of treating the COVID virus. Because if you don't find effective ways, people are going to have this deep-rooted fear psychosis. And that's going to be an even more catastrophic impact on human society and human psychology, which we don't realize, okay? So I think we need to look at effective treatments. I know that many companies, including our own, are working on therapeutic vaccines based on antibodies, which is really not the long-term solution, because you just have to do it till the vaccine comes out. But lots of efforts are going on saying, can we get some of the convalescent, serums and, isolate some of the, cocktail of antibodies that are fighting the virus? Is there a way of actually amplifying these and culturing these antibodies and giving booster shots to, people throughout the year, or people at high risk throughout the year and things like that? I mean, those are some of the things, but I think it would be great if you could actually find a drug like we did in the HIV times, where you finally found that cocktail of antiretrovirals, which finally said, oh, now we can control AIDS. Those are the kind of, drugs and therapies we need to find very fast. I know that a lot of talk about hydrochloroquinone and all these kind of, evaluations are being done. I know that there are many kind of hypotheses that, oh, maybe the Indian population is an outlier because of BCG vaccination and because we've got innate immunity. But, we need evidence to prove all of that. Right now, it's all just hypothesis. But I just feel that when you talk about a post-COVID world, it really depends on how quickly you find that vaccine. Okay, so until you find the vaccine, you actually have a very big challenge. Even the economy is not going to recover till you find that vaccine, because there's going to be this fear psychosis that is going to bring down consumption. And for any economy to revive, you need consumption to go up, right? Right now in India, for instance, only essential industries are allowed to work. There's one fallout of this whole this crisis is that a lot of digital technologies are beginning to work very well. For instance, suddenly online learning is becoming quite popular. And a lot of online teaching companies and online learning modules are becoming extremely accessed, even in a country like India. And I feel that this is one very positive thing, because you were kept on trying to induce and encourage people to go online. This is forcing people to do it. And I can tell you, in a lot, most people are forecasting that schools will be the last to open. So schools and colleges are not going to open, I'm told, in many cases till September at the very earliest. So you're going to force people to do online education. So that's interesting that technology is actually solving a certain problem. Another thing is, a lot of people are getting into online retailing, because today you don't want to go out into, there's no malls functioning, by the way. So you have to necessarily shop online. And the delivery services are becoming very large. So you're actually creating a new kind of job market for delivery services. So interestingly, they're allowing this is an essential service, because they don't want, in this quarantine time and the lockdown time, they're actually allowing delivery services. So a lot of your, whether it's your food, whether it's your day-to-day requirements, or whether it is your medicines, they're actually being delivered through these delivery services. Thirdly, I think, of course, we are going to see a big social change. I think people are going to be very wary about traveling. In fact, today it's very interesting that people who used to madly travel at the drop of a hat are suddenly finding, hey, we can actually have meetings like this. And actually, I'm having far more meetings today than I ever had. Because otherwise, you had to feel, oh, I have to travel to New York, or I have to go to London, or I have to go somewhere else to have this meeting. And actually, it's not necessary, because you're actually able to work in this virtual way, which is also a good thing and a bad thing. Because I don't think you want so much social distancing that you don't ever see people face to face. So, but this is actually teaching us to work efficiently as well, okay? Work from home, for instance, has become a big part of this phenomenon. And work from home is also something that has been forced on us, because I think we do need to have those work from home models which can rotate. We never thought we could work from home at such large scale, and today we are doing it, right? So I think a lot of interesting things have come about where technology is helping. Can you imagine if this pandemic had happened maybe 10 or 20 years ago, how would we have actually functioned? I'm trying to think, where you didn't even have, you had very poor mobile phones, you couldn't do this, where, your bandwidth was so low. Just think about it. Today, actually, technology is going to make this even more advanced, I feel. And today we have things which can actually accelerate a lot of things. Pardis just talked about, sharing the gene sequence of the virus very fast. How could you do all this? Because we have such advanced technologies to sequence genes, to decipher genes, to share the genome very, very rapidly. Now, all this was not possible, 20 years ago. So I think our rapid response ability is also becoming very, very strong. And I think this is what we need to understand. And, to add to Pardis's comments, it's very sad that VC dollars were all going to, oncology, to neurology, to all the sort of, chronic diseases and non-communicable diseases. And nobody used to bother about infectious diseases, because they said, oh, that's a third world set of diseases. It's not going to bother us. It's not going to affect us. And this is a wake-up call, because this is not about the third world. This is not about restricting such diseases to the developing world. Unfortunately, Pardis, in the past, Ebola was isolated to Africa, and they all thought, oh, it only happens in Africa. It's not going to come to us. Zika, oh, it only happens in Latin America and some of the poorer countries. Doesn't affect us. Oh, SARS, oh, it only happens in Asia. It doesn't really affect us. So, this was the attitude of the West to some of these pandemics or these outbreaks. But today, I think it is a rude shock to everyone that the interconnectedness of the world and the travel connectedness of the world has spread the disease so fast that they didn't know how to handle it. So I think now you are going to see a lot of money spent on infectious diseases because the West now knows that it will affect them. So I always tell people, I said, USA will decide when the pandemic is over. Okay. As you know, it's nothing to do with whether, you know, the numbers are down or this or that in other parts of the world. US will decide now it's over, because only when they feel comfortable that they are on top of the virus, then only will the world open up for business. At least that's my viewpoint. Okay.
Thank you, Kiran. That's absolutely correct. India is getting a crash course in e-commerce, work from home, and all the related technology. A case
And
in
I
point is,
must tell you, you know, you mentioned that the Bluetooth, technology to contact trace, right? And also has actually come up with a large number of these technologies, Bluetooth-based technology. So there is, the government of India itself came up with the Setu app, which actually starts doing contact tracing. Of course, I think that's going to be, and that's how they've managed to trace a lot of the people. You can imagine a society like India, if one person infects somebody in a slum or somewhere else, how do you trace everyone that's come in contact with those people? But they have managed to actually trace a large number. So I think you need technologies. I know everyone's using temperature profiling technologies today. And of course, when you see all those very high-tech things in China, we're not that high-tech, but at least everyone is using temperature profiling at entry points, at exit points, just to make sure that nobody's running a fever at least. And so a lot is being done. You know, I mean, even the way they are collecting samples, things like that, you know, they have these drive-in sample collection booths, all kinds of things are happening. So it's very interesting to see the kind of innovation that's coming up, the kind of new businesses that are sprouting every day because of the COVID crisis. So I think it's a time of making an advantage of an adversity. I hate to say that, but it is happening. But I really want to see the end of this, because it's not going to be a very easy world to live in. In fact, I'm very glad that I've spent most of my life in a happier world, in a normal world. And we, unfortunately, at this time are living in a virtual world. I've been always very uncomfortable with the virtual world. And I think I saw this beautiful ad on Emirates, you should watch it, where it really talks about when will we able to have a walk in the park, when will we able to see a game in a stadium, when can we watch a concert in an auditorium. These are all things we took for granted. Look how it's changed our lives. I really hope that those times come back very soon, because at the end of the day, we are social beings, we are social animals. We need to meet people, we need to congregate. We are gregarious as a race.
absolutely. We had Dr. Sefi yesterday at our webinar, and she asked for not using the word social distancing because humans cannot social distance, and she called it physical distancing. Anyway, but this, my next question is for you. There's a lot of talk around pool testing and like we discussed, contact tracing and efforts to flatten the curve. What are some optimization strategies to combat this virus, since it has become I hate to say it has become a globalization disease? Like Kiran mentioned, what happens if the virus stays in Syrian refugee camps? I mean, vaccine is too far away. So can you comment on what could be some steps that could be taken, and also how can your tech help India?
Yeah, and so the first part of your question is just sort of what are for the different kinds of infectious disease testing, how can it be helpful? Yeah, so there's a talk I've been giving for the last 6 years that talks about this idea, tells you the story of what happened with Ebola, how it circulated for 4 months before anybody could identify it, how that's not the world, how technology, how close we were to a cataclysm when it hit Lagos, Nigeria, city of 20 million, on the eve of the biggest religious holiday of the year. And sort of explains that really what we need is fundamentally methods to detect viruses at anywhere, from the most remote village into the advanced labs, in the cities and states, and that we then need to connect that information in real time, in a federated model across the globe, and then engage people to participate, incentivize them to know that if they come to attention, something good will happen. They won't be quarantined or thrown away, but they will be helped and aided, and then empower every actor in that system with the best information that they can have while we all work to overcome. So those are sort of our 5 pillars: detect, connect, engage, empower, and overcome within that context. We've now, continued to work on that here, with that ability to sort of detect and connect and empower individuals. And the kinds of technologies that we think are needed, COVID or not COVID, is the ability to detect circulating things in the most remote villages with paper-based technologies or other kinds of very remote technologies that could also be developed within days, right? So new viruses identified. When the genomes were published, the technology we use, we had a working diagnostic in 3 days. That's the world we should, be able to identify, have a working diagnostic that could be rolled out immediately, and that could instantly be manufactured anywhere as well. We also, the kind of technologies that we're building are these ones that can do 5,000 tests simultaneously. And it'd be great, we can, here we probably need the 5,000 COVID tests simultaneously, but the way we'd originally envisioned it, and how we've laid it out, is that you can, we took all 170 viral genomes for which there was enough genomic data to actually design something, and we ran it, and we could show that you could take one patient sample and test them against 170 different viruses. And these are things that we could do in clinics everywhere. And then obviously there are things that we need to discover that wouldn't be in any of the things we've seen before, and then to have sequencing capacity. So these 3 layers of saying, that anywhere in the world, if there's something circulating that we're worried about, flu or COVID or RSV or whatever it might be, SARS, that we'd have working local diagnostics that could be done as close to point of care, even by individual eventually, as possible. And then ways that hospitals could rapidly screen for a wide array of viruses, and then allow people to then discover new things. And so this is the kind of framework that we think about that is needed, whatever technology that we use to do so. But we do need things that activate immediately. And one of the reasons why we invest in the CRISPR-based therapies as a version of the kinds of things we're interested in is we're interested in things that could also be developed in 3 days. So, create algorithms where you could basically develop the new therapy, within 3 days that just attacks the virus's genome and destroys it the way bacteria know how to. So that's sort of the way, we think about it is in that framework. And fundamentally, when I do go on my, when I have been going and mining this pitch over years and years, the thing that I always say is that there are many existential threats to humanity, be it, climate change and nuclear war and, beyond. But infectious disease is one that we have a simulation of what we need to do every year. Every year, that bug that goes through the office that makes Janice down the hall sick and you're worried is going to make you sick is the same thing that could be the pandemic that could kill people. And so if we just figure out how to stop spread in our schools, in our offices, in our nursing homes every year, we would actually solve this problem. So it's almost like we're not even preparing for a threat that may happen. It's something we could stop now, right? We have, hundreds of thousands of deaths from flu every year, millions of deaths from infectious disease every year. And the incentives could not be more aligned to protect from a future pandemic and stop current, life costs, economic costs, and beyond. So that's how we think about it.
Absolutely. I've been seeing from my years in the US and then me coming back, I've made some of those comparisons about pre-COVID US and post-COVID India. Those are the similarities that I have seen as well. Great. Thank you for this. My next question is for you, Kiran. It's a serious question, albeit due to some geopolitical forces. The serious question has become the global pharma trade, with supply chains being disrupted and whatnot. What does it look like for the global pharma industry and the pharma industry at home in India?
So I think India has always been a very strong pharma hub for generic drugs. And I think right now, of course, it's at center stage because of this huge demand for the hydrochloroquine sulfate tablets. And I think, India actually is in a position to produce large quantities. And I think it is now come to a state where it feels that, well, it's not just about hoarding the drug for yourself, but you must give it to the countries that also are very badly affected by the virus. So I think they are beginning to export this drug. But apart from that, I think India is also a huge vaccine producer. And I think, when you look at all the capabilities that we have in India, it is an interconnected world. And I think we are also looking at affordable access to many of these products. If you look at the numbers that are affected by this virus, it's millions. So I think you need to have an approach which is and I've always believed in that. And today my line is coming so true, because I said, to me, a blockbuster drug is not about $1 billion, but about 1 billion patients. And this is what it's all about today. A pandemic is actually addressing or affecting or infecting billions of people around the world. So I think that's what it's about. We do need to focus on creating a very large pharma cooperation around the world, which is really about making sure that we are prepared for any kind of pandemic, any kind of not just outbreak, but also we need to look at sharing our resources globally in terms of healthcare. Whether it is even the non-communicable diseases or the communicable diseases, I think there has to be access to these important life-saving medicines. And so far, we've been very unfair about providing that access. The access has only been provided to those who can pay for such drugs. And those who can't pay for it, too bad. That's the attitude we've had. So a lot of what we're doing in India has been about making sure that the poor have access to these drugs. And I think vaccines, even if a vaccine comes out, why do you think we also want to develop vaccines in India? Because you might suddenly find that, yes, the US might come up with a vaccine, but that vaccine may not be affordable by most of the other poorer countries. And that should not happen. So I think we need technologies again to bring down the cost of access to these very important life-saving products. That's the way I look at it. And I think India can play a good role. And I think we need to be very collaborative. I know that right now, of course, I'm also collaborating with a number of companies around the world saying, look, let's try and develop vaccines, diagnostics, whatever else we want to develop and make it affordable because this affects the whole world. It's not just about this country or that country. Right now I'm even repurposing one of our antibodies, because when I saw that the IL-6 antibody was being trialed in parts of the world to see whether they could, address the sepsis shock that sets in because of the cytokine release. Well, we have a drug that actually does the same and more. And we said, why don't we repurpose that drug and see whether it works? So I think today people are trying everything, because they really don't have clues. Like Pardis said, if we can actually have a very precision-oriented, rapid response approach to any virus, we wouldn't be in this position. And that's what we should be getting to. How rapidly can we develop a drug towards a virus? How rapidly can we develop a diagnostic that forewarns us? And how rapidly can we develop, treatments that really are effective?
Absolutely, Kiran.
For that matter.
The vaccine that Moderna Therapeutics has taken to human clinical trials, and also Inovio that has taken to human clinical trials, is an IV-based vaccine, which sort of you have to go to the hospital, sit there for 2 hours and take it, which by itself in India is going to be a massive challenge. You need that kind of infrastructure. Yeah. It is not like the polio vaccine that we created, which was just a few drops, and then you can actually vaccinate.
No, you're very right, Ishita. You're very right, because these are the kind of questions we have to ask, and that's why I'm saying that if you're going to make a very expensive delivery of a vaccine, then who's going to be able to afford it, and how can you deliver it so fast? You need to give to so many people. So is it going to work? Those are the kind of questions we need to ask.
Absolutely, absolutely. Pardis, you are a virologist who uses AI. Can you comment on what does that entail and the subsequent data that is being created across the globe that, like Kiran mentioned, could be harnessed by startups all over the world, by big pharma all over the world? Is it like a global data offering?
Yeah. Let's see. I'm ultimately my lab, we work and use all we have this collective of virologists and machine learning experts and beyond, kind of working together to see how we can solve problems. And it's always finding out what are the solutions that are useful. So an example of a place where we use that is Hayden Metzke, a graduate student in my group, has developed this way of kind of downloading on a daily basis all of everything in GenBank, every virus genome that's been sequenced, and to generate guides to detect anything, and to look for specific patterns of what is successful and what is not successful, train computers to model that, and then to replicate it. And because we have this method that I'll shout out to the names of the different folks in the group that are developing it. Cameron Mirabold and Sherry Ackerman in my group have developed this in collaborating with Paul Blaney's group, have developed this way of doing 5,000, it's actually 65,000 tests we do simultaneously, but 5,000 specific, we replicate multiple times. So we generally can do 5,000 tests simultaneously to design guides to target different viruses. And then we can use that data to then train our models better. So it's why it's valuable to have this interdisciplinary approach, is that we can then develop experimental models to then test our computational models and go iteratively beyond that. So like one example of a place that we're using machine learning is to understand essentially how these CRISPR targets these viruses and how to better improve the way we design them so in the future. And we do that also both with on the diagnostic side, but we also have different models in our lab where we have flu. So we've flu, LCMV, which is a lot like a virus called Lassa virus, as well as VSV in the lab. And we can actually test how well the CRISPR guides can knock down the virus. And we showed in one of our studies recently published that we can knock down an flu virus and decrease its infectivity 300-fold. So this could be a good use of a drug in the future. But another thing we do is we tile the entire genome. We actually design guides to every single part of the genome and then start to figure out which parts actually are the most potent inhibitors of it, and then try to, once again, model that better. And then the other kinds of things that we do is use machine learning in our models. So we've been developing these apps, and essentially the idea of the apps are a lot of what's popular now is just incentivizing people to put the best quality data by giving the best quality information back. And so we've partnered with organizations like International Medical Corps to test out during the Ebola outbreak, to test out different models of, if you input data, what kind of information do you get back about diagnostic or prognostic results. And so constantly trying to think about ways of improving predictions and to empowering people in the field and frontline workers using these kinds of technologies.
Can I ask Pardis a question?
Sure, yeah.
I just wanted to ask you, have you got any kind of predictive analysis done on remdesivir?
I have not, no. I mean, in all honesty, about its efficacy or its sort of,
does it work well against the virus? I mean, that kind of stuff. Because
oh yeah, so we haven't been following the drugs that are out there so far. I think other people have been, but not ourselves. So yeah, we're kind of knee deep developing these. You're always trying to find out in these cases, like where are the places we can have the most impact, because there's a lot of things we work on, but there's also a lot of people working on it and a lot of things to do. So in our case, we've really been focusing on trying to get these diagnostics out there and trying to move forward some of these other approaches.
And are there differences? And are there differences between the viruses in different geographies?
There are, yeah. I mean, so early on, that as I mentioned before, early on, we could tell that the virus probably had just entered the human population because all of the genomes look the same. They now look very different, and you can see viruses. You can, and it's interesting because you can model and you can say, oh, this virus likely came from here. So we're now studying the introductions that happen in Boston, Massachusetts, and we're sequencing the genomes, and we can tell that we've introductions that have come from all different parts of the world. So the virus is now differentiated pretty quickly. It's an RNA virus, so it's going to gather mutations, and those mutations are going to be able to allow you to see where they're coming from. The question, and I think the potent question I imagine that you're asking, Kiran, is that, are they biologically different, not just that they have different mutations? Yeah. And that is a question that my colleague Jeremy Lubin at UMass Worcester and others are asking. They're doing functional analyses of these different mutations and trying to understand whether or not they have an effect. I collaborated with him on a project during the Ebola outbreak. There was, right as the outbreak, suddenly, if you remember the Ebola outbreak, it was like, oh, it's a problem, and then it's like, whoa, it's a real problem. And there's this point where the trajectory really changed, and suddenly there were cases everywhere. And right at that moment, there was a new mutation that emerged in Ebola's glycoprotein, which is where it binds to human cells. And it's still in progress because it's difficult to do a lot of those tests on a deadly virus like that. But what we published already was that in cell culture, we could show that it increased the infectivity of the virus. It made it better able to infect human cells. And we saw individuals published that SARS also mutated in what appears to be a biologically meaningful way. So, I mean, it's always a controversy. It's not like a virus will suddenly completely transform, but it will change. And if you give it enough opportunities to transmit from human to human, there's enough generations that the populations will change and things can happen. And sometimes they get better. And, we expect that the virus is going to try to kill us all off. So we expect that it'll try to accommodate, but it's not really thinking, it's just changing. And the more chances you give it to change, the more chance a change will happen that is unexpected and undesirable.
Yep. I think where Pardis is in the academia and where Kiran is in business, I think there's a lot of synergies that you guys can explore for Pardis to feed into information and Kiran to actually execute it on a large scale, given where she sits. I'll be sure to introduce you guys to ensure that this carries on. I know, Kiran, you're short on time. Do we have time to squeeze in one more question, or should we call it a day?
Ask the question to Pardis because she's the expert.
Actually, my question was around you advising the governments of various states in the country. And
okay, so let me share with you one of the things I'm trying to do, and maybe I'll ask Pardis to comment on it. So one of the therapies that are being talked about is the enriched plasma therapy from convalescent patients. I saw that US FDA, UK, Canada, a lot of countries are trying to at least, use this therapy to save some patients. And so I thought, okay, in India, if we're going to have to be prepared, I've advised a couple of the state governments to start collecting the convalescent, patients' blood in a separate blood bank, so that you can quickly kind of start enriching these blood plasma. And if you need to use it, or if you can use it on some of the serious patients, you are actually well prepared. So quite a few of the governments actually have set up these blood banks, and they've started collecting blood from these recovering patients as blood donors. And of course, there are exclusion criteria because we are not allowing certain types of people to be the donors. But at least the younger, healthier people who are recovering fast, we believe that they could be good donors. So I wanted to hear whether that's is that a good approach? What do you think about that?
Oh, sure. I mean, using convalescent blood and using antibodies from individuals who've recovered is an age-old. It's it's one of the first kind of therapies, and it's been shown to be effective in many instances in where there isn't a drug available. So I think it's very powerful, and we've seen it in previous outbreaks being used, and Ebola classically used. And so I think it's definitely a useful approach. It is one of those things that's difficult to scale, and it does require this commitment to individuals, and you want to be mindful of that. Like, there's I'm one of these people that always thinks of like, what's every way this can be co-opted in a terrible way? And so I'm always thinking like, you also don't want those individuals to be overpoached or anything happening there. But I think you're doing it the right way of being very proactive and doing it mindfully, in advance so that it doesn't suddenly become
by consent. It's by consent.
Yeah, exactly. And by consent and thoughtfully trying to think about how much can you actually get to, how many individuals can you help, how do you use them most wisely.
So I wanted to ask you a question, Pardis. When you have these convalescent patients, how long do you think their antibodies really last for you to keep taking blood from them?
I think it should last for some time. I mean, we don't really know that much about COVID.
I was asking you for Ebola, you know.
Oh, for Ebola, I mean, for a very long, I mean, you can have antibodies for a very, very long time. It is about I mean, and we've seen, I think with Ebola, there were, decades on that, they still had the antibodies, and that's why we get this neutralizing long lasting. The thing is about how potent it is, like how much of it is circulating will go down over time. And so I think in the lifespan of this, it will be useful for some time. But I know much less about, and again, no one really does. That's a big question, because right now people are talking about testing people and then allowing people who have antibodies to come back into the workforce. But there are a lot of open questions to that even. Are they clear? Is it possible that they're still shedding the virus even though they're, they themselves are clear, or are they actually not immune? We don't know all of those things. So what's great is that we have the global community all working together and lots of data coming out, but we still haven't pieced together the whole story. And so until we know all of that, we have to be very cautious.
Thank you.
Oh, thank you, by the way. Yes. It's lovely to listen to you speak. I really appreciate this opportunity, one, to speak to all the different panelists, but to get to meet you. And I think it's really important when academia and biotech connect, because there's insights that you have and ideas you have that are tremendous and come from a different angle. So I really enjoyed listening to you.
Yeah, me too. So thank you so much, Ishita, for connecting us, and all the best and stay safe.
Thank you, Kiran. Absolutely. I hope the Indian life sciences startup gets the jumpstart that they deserve. And for this, I hope that the US VC dollars flow into infectious diseases. And I hope US actually sets an example for the rest of the world. Thank you all. This webinar was fantastic. Very grateful to the time that you've given us and your lovely insights.